Hello, I'm back, feeling a little bit better. For those of you who sent me get well wishes, I really appreciate that. You know who you are, it's too many of you to mention, but I really do appreciate that. Thank you very much. Some of you wanted to know what the problem was, and I will tell you that I came this close to taking a dirt nap. Not last Wednesday, but the Wednesday before that. I ended up in the emergency room with what's called a supraventricular tachycardia, which, you know, happens to a lot of people for a lot of reasons. For me, it happened because I have a damaged heart to begin with, and I've had that for about 5 years now. Real quick, just to get you up to speed, 5 years ago I had a knee surgery that went horribly wrong. I got an infection. In the process, had another knee surgery, straightened it out. But during that time, that my doctor had me on Vioxx, and this was previous to the Vioxx being yanked off the shelf for killing people. I had a heart attack, and I attribute that to the Vioxx, and I can't think of anything else it would be. I was in much better shape. Someday I'll show you this gym. It's a lot more than what you see. There was a time in my life when, you know, I threw these weights around like they were nothing every day. Having said all that, though, that was then, this is now. 5 years later, lots of different medications, some of which do nothing but pack the weight on you. Which brings me to another thing. If you're taking Toprol XL, I'm not telling you to stop. In fact, don't stop, because it can cause a heart attack or a stroke if you do. But you may want to do some research on Toprol XL. It's not for everybody. And talk to your doctor about that if you're having any kind of problems before you end up in the emergency room. So anyway, I've always avoided talking about healthcare, mainly because, you know, it's just a touchy subject for me. But other people have done healthcare videos. Lazy Mornings did a little bit about healthcare, about medication. Joy, Fringe 911, Matt, Patriot Action, Lewis, Mad Max, they've all talked about healthcare in one form or another. And I've kind of always sidestepped it because I just didn't know if I wanted to come in with it, because I'm a very open person. If I'm going to come into something, I'm going to tell you what's what, how it is. I am very blessed in the sense that I can let me put it this way. My heart issues are all pre-existing to the healthcare that I have now. So my healthcare now does not pay for any of my cardiac issues. Or very little of it. Most of that comes out of almost all of it comes out of my pocket, and that's my medications, which are about $300 a month, and any bill that comes up. For example, I just went to the cardiologist today, and for my little stay in the hospital, his bill, not the hospital's bill, his bill was $1,700. Now I negotiated with him. I said, look, how much are you going to take? You know, let's settle this, because I'm not paying you $1,700 bucks, and that's not what he would get from any insurance company anyway. He said, I'll take $1,000. Okay, well, $700 bucks off. I'm cool with that. So I wrote a check. I know there are a lot of people who cannot do that, and for those people who cannot just write a $1,000 check, those people are screwed in this country. Now understand, I'm guessing, I haven't got the hospital bill yet, but it's probably going to be about $25,000. Okay, and I will negotiate with them, okay, and probably pay $17,000, $18,000, and I will pay that out of my own pocket. For a lot of people in this country, that's not doable. I'm very blessed, and I realize that. The working people in this country are so screwed, and it's wrong. It's absolutely wrong. Now I am, for the most part, a fiscal conservative, a Republican, but I'm very liberal on a lot of social issues. I'm pro-abortion. I'm pro-gay. I don't want to say marriage, but pro-gay union. There are a lot of things that I support that would be considered very liberal. However, when it comes to the government, less government is better as far as I'm concerned. So I'm really in kind of it's a really funky situation for me, because, you know, I would be completely against some kind of socialized health care. However, putting our heads in the sand while families are being devastated and financially crushed is absolutely wrong. I think it was Lewis, Mad Max, or it might have been Matt, from Patriot Action, who said, nowhere in our Constitution does it guarantee us medical care or health care. And they're right. And they're absolutely right. There's no way to argue that. But we as tax-paying American citizens have a right to decide where our money is spent. For example, if we could spend billions of dollars bailing out, or I don't even know if you want to call it a bailout, but billions of dollars, we'll call it a bailout, what the hell, with Bear Stearns. If we can send billions of dollars overseas in financial aid, we give billions to Egypt, we give billions and billions to Africa, and for what? For medical care. We're paying for Africans' medical care, which, you know what, may be the right thing to do. I'm not making that an issue. But yet we can't help our own citizens. Okay, some of the things that need to happen is, one, right now the way it is, everything over 7.5% is tax deductible. So for example, that $1,000 check that I wrote to my cardiologist today, everything other than the first 7.5% of that, I'm taking off my taxes. Okay, and that's cool. For a lot of people, maybe that doesn't help them much, but I think for a lot of people it does. They need to make that 100% tax deductible. Period. 100% tax deductible. Another thing that they need to change is go back to the way it used to be. It used to be medical bills did not reflect on your, or I should say unpaid medical bills did not reflect poorly on your credit report. That needs to go back to that, because credit reports today are too important for people. They use your credit report to decide how much you're going to pay in auto insurance and all kinds of things today. How much you're going to pay for your home, for the interest rates on your car, the whole 9 yards. So my feelings are that nobody should ever have to worry about an unpaid medical bill being reflected poorly on their credit report. Another thing that they need to do is change the laws back to the way they used to be. You used to be able to file bankruptcy on your medical bills. Today you can't. Some people, that's their only hope, is to be able to file bankruptcy on those bills. The only way they're going to save their home, save their car, save their lives, financial lives, is to be able to file bankruptcy on that. As an American taxpayer, I'm okay with people being able to file bankruptcy on their medical bills. That's just me. Now, I don't want to see a socialized healthcare system in this country, but what I would like to see is some simple steps the government could take to make things a whole lot better. I will tell you, when I went to the emergency room, nobody ever asked me if I had insurance, and they gave me outstanding care. Now, they did ask me what I did for a living, so maybe that helped. But the fact of the matter is that when you show up to the emergency room, everybody's equal. Donald Trump down to the lowest person, they're equal. In this country, we have the very poor covered under Medicaid. We have the very rich covered under their checkbooks. It's the people in between that are really suffering. And that needs to change, because the people in between are the ones paying a big part of the bills. And that's not to say the wealthy don't pay a big chunk of taxes, because they do. And I might even say they pay too much tax. But the fact of the matter is that we need to do something to help the people in the middle. Do away with the whole pre-existing condition thing. Now, I know, for example, my healthcare provider is in business to make money. And for him to have to cover things that was before he wrote a policy for me, maybe that's wrong. But pre-existing conditions is killing a lot of people. There are a lot of people who do not seek health care. They go to work every day, they pay their taxes, but they don't seek health care. Maybe they don't take their medications. Like I said, my medications are $300 a month. For some people, that's not doable. But yet they go to work every day and they pay their taxes. And the only other option that they would have is just to quit work and get on the government dole 100%. And then they wouldn't have that problem. They'd get their medication. That's not what we want. That's not what I want. So, you know, things that we could do, instead of a socialized healthcare, maybe a government-backed healthcare for what I like to call the working, not working poor, but the working uninsured. So, depending on what your income level is, there should be a government-ran health insurance for those people. In order to get on that, you have to make under a certain amount of money. You're not considered poor, but you're not considered rich. And I don't know what that would be. Say everybody that makes less than $80,000 a year, total household income. And $80,000 a year is not a lot of money, so don't give me grief on that. They should have the option to purchase at a reasonable cost health care through the government. And I'm not saying the government taxes and then boom. But you know, bottom line, we spend our money on a lot of things in this country, and as taxpayers, we should be able to tell the government, look, we're okay with you supporting other countries, we're okay with the humanitarian aid, we're okay with all that stuff, but you know what? Charity starts at home. Bottom line, charity starts at home. And we can do better in this country, and I hope John McCain starts talking about it, because I'd like to see some debate on his end when it comes to the health care, because the Hillary plan scares the shit out of me. Anyway, listen, just a quick update. I'm still alive. I'm a hard man to kill. I don't plan on being dead anytime soon. But thank you all for your concern and your good well wishes, and take it easy.